All right, for this explainer, we're going to be medical detectives. We've got a case on our hands, a young woman with a really sudden, pretty alarming illness. And by following the clues her own body is giving us, we're going to uncover the telltale signs of a very serious condition.
So, picture this. A 24-year-old woman needs help, and it's urgent. She's confused, she's got a high fever, and she's dealing with a headache that's just off the charts. The clock is ticking here. So what on earth could be causing all this?
Okay, so where do we even start our investigation? Well, we start with the first set of clues, the symptoms she had right when she walked through the door. Let's look at the case file. We've got that severe headache and fever, for sure. But there's more. She also has photophobia, which is just a fancy way of saying she's extremely sensitive to light. And here's the really critical part. Her mental state is off. She's disoriented, slow to answer questions. This is definitely not just a simple flu. Seeing all these symptoms together, that's a huge red flag that something is seriously wrong with her central nervous system. Now, this collection of symptoms points us in a general direction, right? But there is one pivotal clue, one specific finding from the physical exam that is going to break this case wide open. So everything we've talked about so far is what the patient is telling us. But now it's time for the physical exam. And this is where we shift from what she's feeling to an objective, solid sign that's going to crack this whole thing. And there it is. The key finding is a positive Brudzinski sign. I know it sounds like a complex medical term, but this right here, this is the single most important piece of evidence we have. It's the key that's going to unlock this entire mystery. So what is a Brudzinski sign anyway? And how does it connect to her headache and that sensitivity to light? To figure that out, we need to decode what her body is literally trying to tell us. First things first, we need to get this concept down. Meningism. Now, this isn't a disease itself. It's more like a name for a classic group of 3 symptoms. When doctors see these 3 things pop up together, it points right to irritation of the meninges, those protective membranes that wrap around your brain and spinal cord. Just 3 symptoms. That's it. But this classic triad is a super powerful signal in medicine. It helps doctors zero in on a very, very specific problem. And here they are. Number 1 is nuchal rigidity, basically a really stiff neck. Number 2 is photophobia, that light sensitivity our patient has. And number 3, the headache. Our patient has the bad headache and the photophobia. So even though a stiff neck wasn't the first thing she mentioned, having this combo is a massive clue that her meninges are inflamed. So where does the Brudzinski sign fit in? Well, it's a direct test for that meningeal irritation. It's actually brilliant how it works. The clinician gently lifts the patient's head toward their chest. Now, if the meninges are inflamed, that simple movement stretches them, and it's painful. So the body's protective response kicks in to relieve that tension on the spinal cord, and it triggers an involuntary reflex. The patient's knees and hips bend automatically. It's an amazing built-in signal that shows us just how irritated those membranes really are. Okay, so we've collected all the clues: the fever, the altered mental state, those symptoms of meningitis, and that definitive physical sign. Now we can put it all together and finally name our culprit. When you lay it all out, the conclusion is crystal clear. You have to suspect meningitis. Meningitis is the inflammation of those protective membranes, the meninges, which just so happens to perfectly explain every single one of our patient's symptoms and signs. But a crucial part of making a good diagnosis isn't just about proving what it is, it's also about proving what it isn't. So why are we so sure this is meningitis and not something else? Okay, so what about something like encephalitis? I mean, that's inflammation of the brain tissue itself, not the membranes. While some of the symptoms might seem similar, the physical exam is what really separates them. Since encephalitis doesn't primarily target the meninges, you wouldn't typically expect to see a Brudzinski sign. The fact that it's present here is what strongly points us away from encephalitis and directly toward meningitis. And hey, what about a bleed inside the skull, like a hemorrhage? That could absolutely cause a wicked headache and disorientation, but a couple of our key clues just don't fit that puzzle. For one, a bleed wouldn't cause a fever. That almost always signals an infection or inflammation. And 2, it wouldn't cause that positive Brudzinski sign. So we can pretty confidently rule out that one. So let's just quickly retrace our steps. How did we go from a bunch of confusing symptoms to a really confident diagnosis? It was actually a very clear, logical path. It's really a 4-step process. You start with the patient's main complaints. Then, the clinician spots that classic pattern of meningismus. After that, the physical exam confirms it with the positive Brudzinski sign. And all of that evidence leads you directly to a strong suspicion of meningitis. It's a really beautiful piece of diagnostic work when you see it laid out like that. So now you can see how clinicians piece together all these clues to solve a life-threatening medical mystery. You can recognize the signs. But this brings up the next big question, doesn't it? What is it that actually causes this dangerous inflammation in the first place?